acute pain, I would like the electrodes to be kind of in a broad area so that it can get to all of her very painful shoulder region. If I put them all too close together, I'm going to get just a tiny little spot in that shoulder.
And your check sheet will talk about acute pain to surround the pain and more chronic pain to put the electrodes on the pain. So make sure you're getting it broad enough for that acute pain especially.
So there's my channel, whatever it is, channel 2, it doesn't matter. It just matters that I get the first one. Okay. So one channel running this way, a second channel running this way, it's going to get to this whole region. Okay? All right, good. Now, as far as putting a cold pack on first. Some people like to put the cold pack on first and then start the current running. That's fine as long as you and your patient understand that there's no pulsing that I want with this treatment. It's a tingling sensation only. So if it is pulsing, I might not be able to see that if it's covered with a cold pack. So you just have to weigh that out. If this is her very first time, I might want to see how she responds to this and then wrap her up with the cold. But that's completely up to you guys. The important thing is that you're emphasizing to your patient a tingling only, no pulsing sensation.
Does it change the intensity when you're pressing harder?
It can, yes, you're absolutely right. So if I did start this first, when I am doing it, I want to make sure that I wouldn't press down on it really hard and increase that current flow. Okay. All right, so I'll apply the full pack first. I'm really comfortable that Lily understands that I only want a tingling sensation.
Oh, you don't want the big one to wrap around.
I'll do it, what the heck. She's so tiny, but okay. So I'll do my little wrapping technique. And she's a rotator cuff repair, so it's not as easy because she's not supposed to actively lift her arm. So,
You want the smaller one?
yeah.
So you see how the skills you learned in the first half of the semester come into the second.
Yeah, you're all judging me right now. I can feel it.
Are you sure you want to wrap that way? Not really sure.
Yes, I am. Very comforting. Okay, so far so good. Now, at this point, I would probably lie her down, okay? Because I don't want to turn the intensity on and have her try to maneuver with this and that current flow. So, I'm going to change the pillow. I'd like you to be here, close to my machine. Back there. Thank you for moving your shoes. Get that arm supported. And there's that bell, and she's going to pillow you up. Would you like a drape?
Just throw them on the patient.
Okay. All right, so I'm going to hold this up so you guys can
What
see
else
a little
does
bit.
she need to ask? Would you like a drape?
Got it. Okay, so the machine. Over here on the left-hand side, you'll see a little button that says IFC or pre-mod. Hit it once, IFC lights up. And then, you guys are so lucky, it says high or low. What is that talking about? Acute or chronic, high rate, low rate. We're using an acute patient scenario right here, so high rate. What if I want to see what rate this machine is going to give that high rate at? I can hit a little toggle button up here, and it'll say 80 to 150. That falls into my range, okay? So there's a range that it's running at, somewhere between 80 and 150. It's moving around at that rate. So that's perfect, because that's just what I want. So time over here, typical treatment time is 15 to 20 minutes. I'll set it at 15. And now the only other thing that I can play with is down here where it says scan or sweep. Remember those? So if I hit the button once, nothing's lit up. That's true or static interferential, which means wherever they intersect, they intersect. Nothing's going to change. If I hit scan, it's going to change the amplitude of 1, and so it's going to feel like it's getting louder somewhere else. Okay, it's going to feel that whole speaker, remember, analogy I gave? So it's gonna feel like it's moving. And if I hit sweep, it's gonna feel even a little bit different to her based on the machine that has this patented sweep mode to it, okay?
And
so we'll go with true first, just so that you can feel that one, and then we'll change it and tell us if you feel anything different.
And I'm sure you talked about it in lecture, but just to clarify that the pulses per second, that rate, that 80 to 150, that during the treatment time, that rate changes. The rate changes throughout the 15 to 20 minute treatment time. You're not picking pulses per second for the treatment.
Like we did with tens. With tens, we picked one rate only. This one has a nice range to it.
It varies throughout, which helps to modulate the sensory experience. Yes.
And I could certainly change that rate if I wanted to. I can go back to that toggle for and see what the rate is, and it says my rate is 80 to 150. If I wanted to get down to that 75, I could certainly change my rate. If I only want to be, let's say I just read a study and it said 100 to 150 was the best, I can put it at 100 to 150, okay? So you can play around with that, but you don't have to. That's just future knowledge, okay? Put that back down to about where it was. Okay, so Lily, I'm gonna go ahead and turn the unit on now, get the current running. Is that okay? Great, so you're gonna feel that little tingling sensation. Just let me know when you first feel it. Now I have to wait for my menu. It still says 80 to 150 and then it'll switch back. There we go. So it says 15 minutes again and my intensity is over here. All right, so I'm gonna go ahead and turn it up. Now with this machine, you hit it, it goes up in 0.5s, but it doesn't show you that on the screen. So when I hit it like once, it might not move, but then if I hit it again, it'll jump up to 3, and then I hit it again, and now it's 3.5, but it doesn't show it. So just don't, if you hit it once and nothing moves, just try to hit it one more time, and you'll see it move. And I want to look at my patient. I really want a treatment triangle. I would like to be able to see my machine. I would like to see my patient's response. And are you feeling anything yet? Okay, I'm going to continue to hold it. Okay, yeah, a little light tingling. May I go ahead and turn it up a little higher? I'm looking for that strong, comfortable tingling. Are you doing that? Is it still comfortable? Still tingling, not feeling like it's pulsing in any way? What if it were what if she didn't know? Well, I'm not sure. What could I do? I could slip my hand in and maybe feel if I feel any pulsing. No, I don't. Okay, tingling. And she says, that's strong and it's comfortable. Okay, we'll start. To actually get the timer running, I have to hit start. Start, you have your bell, be back in 15 minutes.